Are you a podcaster? Maybe you've got that big idea and you're looking for a network to join. The multi-award-winning Ozcast Network can get your content to eyes and ears all over the world. Join now for the first month free, and you could be featuring this sound at the beginning of your podcast.
Ozcast.
Simply head to ozcastnetwork.com for details.
Did you know you can advertise on podcasts?
Don't act like you're not impressed.
Find out more at podvertise.com.au. That's podvertise with an s.com.au. Ozcast. The Mental Health Show with Mark Haston.
Let's talk about a program that it's really exciting. And when Jono Knowles from the Metropolitan Fire Service told me about this, I thought we've got to talk about it. And I'm going to get Jono to explain it. Jono, welcome along. How are you doing?
Yeah, very well, thanks. Thanks for having me.
Are you working today, Jono?
Yeah, so I'm working at the fire station today, so if there's any noise about the place, that's what it is.
Yeah, well, you know, your obligation is to me. You understand that, don't you?
Of course.
Jono, tell us about the program.
So I'll start with a walk for a veteran where we met.
Oh, yeah, of course.
How much you've introduced that.
No, not at all. That's a good idea. Well done.
Yeah, brilliant. So it's hard to believe it was over a month ago now, but so at the walk for a veteran, we essentially took to the hills in a 35k hike, very, very hilly hike, to raise funds and awareness for the post-traumatic stress and how that affects families.
Yeah, absolutely. It's a wonderful cause. It's a wonderful cause, isn't it?
Yes, yeah. So it's as a result of the exposure through their occupation. So so I guess we've partnered with Chad McLaren, at the Walk for a Veteran, and we've actually just incorporated as a charity. When I say we, I was also elected to the board. So that's very exciting. That's some new news.
That's wonderful. Congratulations, mate. You deserve that.
Yeah, thanks. So we're all very excited about that. But I'm also involved with the Australian Professional Firefighters Foundation. And so Scott Rouse, who's the president there at the moment, tasked me with collaborating with the Metropolitan Fire Service's Wellness and Safety Department to make sure that we weren't doubling up on workload, and perhaps we could share the load a little bit, and you know, we could take some of the weight off their shoulders. I mean, they're a very, very small team doing an enormous amount of work, and it's a very, very exciting new department because it is very new and it's sort of the chief officer's little baby at the moment. So, you know, they've got an enormous project ahead of them to build a decent wellness and well-being program. So that's how all this collaboration sort of started, and I ended up going to the conference, the Global Alliance Conference for Post-Traumatic Stress that was put together by the Road Home late last year it was. So they're funded by the Hospital Research Foundation Group, and we're working very, very closely with the Road Home now as a foundation. But I went to this conference and met all these great people, and everyone was talking about how great the collaboration was. And you know, after Scott had asked me to collaborate with the Wellness and Safety Department at the Fire Service, I thought, well, why don't we include all these other brilliant minds as well? And, you know, when we're discussing our lingo and all that sort of stuff, they can look at it from a completely third-party perspective and perhaps add some synergistic benefit. And, so we ended up meeting for the first time a couple of months ago, and we've met again once since, and again we'll meet on Thursday. And it's not just meeting. We've got to work very quickly, forming smaller working groups and so on. So in putting together all of these people, what are you hoping to achieve? What's the ultimate goal? The ultimate goal is to put together a substantial wellbeing program for firefighters and their families that benefits us in the long term, but also something that perhaps people around Australia and even around the world can copy. And the way that we'll be able to do this is by collaborating very, very closely with research. So we're very, very research heavy in our collaboration, but unfortunately you need research to justify any funding. Now, we're very, very open about this. We're chasing a decent federal grant for this program we're putting together. And to do that, you need to put together a very good justification for the request of those funds.
Of course, yeah. It's an art in itself, isn't it, doing those, putting those documents together?
Yes, it is, but fortunately we've got some very, very, very good help. So
good.
Yes.
Good. So how's that going?
That's going very well. That's the overarching project, but I guess there's a lot of steps to get there. We've broken down into smaller working groups, as I said before, but we sort of need to nail those initially. One of the big projects we've got is to basically ask our membership at the foundation, what can we do for you? How are we meeting your needs at the moment? Are there any improvements and so on? Just a very, very open-ended survey. The reason that's a big effort is because when you offer up open-ended surveys, it takes a lot of effort to evaluate them and to go through and analyse them. So fortunately, the Australian Centre of Excellence for Post-Traumatic Stress, who are also a subsidiary of the Road Home, are an incredible research team. They've got a clinical area at Jamie Larkham at Glenside. And the team there are absolutely world class. And when I say world class, it's not just a throwaway. They actually are world class and sitting on our doorstep. So we're very, very grateful to be working with them.
What sort of feedback are you expecting from these people when you put that question out? What do you want from us?
Well, I think firefighters are very creative people generally, and I've already had a number of really great ideas emailed through to me. And I've had some really great chats with people around the traps, and everybody's got great ideas. A lot of it is probably leisure-based. Now, leisure programs are very important because they definitely offer preventative support. We're also looking at interventionist programs. One of our collaborators is the Fire Service Fund. Now, the Fire Service Fund is also owned and operated by fireys for fireys, and has a long history as well. They own several rest and rehabilitation properties around the state that we basically offer up to anyone who's having a tough time or whatever. They could just go there and stay there free of charge, and it's funded by firefighters going there throughout the year and paying lease rates on it. Now, that's a great program, but having seen the Bouldercrest Institute over in the United States and how they can use houses and retreats like that as very, very particular interventionist-style programs that are led by a clinical team, and how effective they are in getting a family back together after some sort of post-traumatic event or something like that, is just phenomenal. So now we're collaborating with the Bouldercrest Institute to potentially build something like that over here. So there's lots and lots of different projects, but we are a big team. So that particular collaboration I'm excited about at the moment. That's the most recent one that we've worked on.
When I know I asked you this when we met 4 or 5 weeks ago, 6 weeks ago. When you speak to fellow firefighters, do any of them open up to you in any way, shape or form about some mental health issues they're having, or perhaps some anxiety issues they're having?
So I think I'll answer this question more broadly. The short answer is yes, but I'll answer this question more broadly, and that is that I watched a fantastic TED Talk by a woman called Brené Brown on the power of vulnerability. Yeah. And it really set things in a line for me about what it meant to be a firefighter and to be part of a team, and to have that peer rapport that we talk about, that peer-based model of support. And the reason this peer-based model of support exists is because we do have that sense of vulnerability around our peers for the most part. Not everybody does, but most people do. Another subsidiary of the Road Home that I'm going to plug is the GEARS program led by Dr. Jonathan Lane, who is doing his PhD through the Adelaide University evaluating this GEARS program, which GEARS stands for Group Emotional and Relationship Skills Program, I think. Yep. So basically what that is again, leveraging off this whole concept of vulnerability. And what that does is build resilience. So we're going right down the road of prevention because we don't want to have to keep cleaning up the mess. So I know that it doesn't directly answer your question. Yes, I have been approached before. But it doesn't necessarily happen that explicitly. We have what's called a hot debrief, which means that the officer in charge of the incident is obliged to go through and ask the crew in whatever means they see fit, how they're all going, and then offer follow-ups. The Wellness and Safety Department are fantastic. The Employee Support Coordinator, and other members from that department will follow you up and say, hey, g'day, is everything going okay? We're very, very lucky to have Dr. Denise Keenan on our collaboration group as well. She sees most of the fireys, I'd say, throughout their career in at least some sort of capacity. She's a clinical psychologist, and I think she runs her own operation called Cognition. Now, so perhaps she'll follow up with a phone call and so on and so forth. So there's multiple layers to this. The big project that I've just handed over to another fiery who's jumped in to give us a hand with some of our mental health projects is the referral project, I call it. So how firefighters go about getting told about other pieces of the puzzle, how they can go and get support from something they've never even heard of before, and perhaps how some of the more evidence-based clinical practice can be referring to, say, non-evidence-based programs, but the organisations like the Foundation can be funding it. So this is why I think our collaboration with the Fire Service is going so well at the moment, and that is because the Metropolitan Fire Service is owned by you and I. It's owned by the taxpayer. It's owned by the public of South Australia. And we have to be able to justify to the public of South Australia how we're spending our funds. Yeah, absolutely. Whereas as a foundation, we already have to justify to 1,200 members how we're spending our funds. And if we choose as a board to allot some of those funds to non-evidence-based programs, which, by the way, we can then evaluate and offer up some sort of evaluative research that can then be peer-reviewed and perhaps make those non-evidence-based programs evidence-based eventually and mainstream. Which is how all programs start. They start with anecdotal evidence and they slowly accumulate what you would call proper evaluative evidence that's objective, and then you're able to have that peer-reviewed by people that disagree with you, and which takes a long time, and then perhaps you present it forward to go to more mainstream clinical practice. So we can sort of slot in there in the interim and fund these programs, but we also need to focus on the referral process. So we're actually getting people filling seats in these programs which are already available.
Yeah, it makes sense. It's 28 minutes to 5, and this is Monday Drive. And we're having a chat to Jono Knowles, who is with the Metropolitan Fire Service, who's heavily involved in wellbeing and looking after people and making sure that the programs are all in place, and that's what we're talking about now. The other thing that we spoke about 4 or 5 weeks ago, I made the point that it's just so unnatural to be involved in a job where you've got to go to a location where there is an horrific scene, but there's no getting around that. I mean, someone has to do that. How do you conceptualise that?
I think in the moment it's probably more so objectively, but I mean, the fire service recruits firefighters who have empathy, and empathy I would regard as very highly as a sought after attribute in a firefighter. But you have to be very careful how you share that. I would say that when you put your personal protective equipment on when you get a call, I think for most firefighters you sort of switch into a slightly different gear where you're a tool that's going to be used to make this person's worst day of their life a little bit better. Yeah. And I guess that's a fulfillment in the job. We try and put as much in place as a bunch of peers and as an organisation to help the firefighters who have been used as tools in that situation cope with what they've seen, because at the end of the day, we are human. And I think for myself, the most difficult jobs that I've been to have been jobs that tear me away from what's going on in terms of firefighting operations or road crash rescue operations into the moment, into the worst day of this person's life. And I won't be too graphic about it, but there was a fatality out on Highway 1 I went to a few years back where this young girl had just lost her father, and her clinging to me at that moment, she reminded me a lot of my younger sister. It really drew me into the moment, and I found that quite difficult. So it's different. And I've been to some very, very gory sorts of jobs where you'd think, oh, geez, that would affect you a lot more. Well, in my view, it was just something nasty to look at. if you would have it that way.
Yeah.
Where you try and remove yourself from the emotion of it and just get the job done.
Yeah, I understand. And that leads me perhaps to another point, and that is when I talk about myself briefly here just to paint the picture, but when I was working at Channel 10 as a journalist, if there were some nasty stories that were on air in the first break, for example, I tended not to watch them. I found it really difficult. I found it very emotional. But conversely, I found that some people were fine with it and they'd got used to it. Is that healthy? I mean, to be honest with you, I'd rather stick with my emotions and be upset about it rather than be desensitised. I'm just not sure. I think that might be dangerous, but you correct me if I'm wrong.
Well, I think a powerful song for me by Jack Johnson illustrates your point fairly cleverly. And it's difficult because I find myself trying to desensitise myself to it as well. So it's a difficult question to answer because I think it's a rather personal thing. I will make this comment, though, on vicarious exposure. That is exposure that isn't directly related to you. It's, you're living that exposure through somebody else. And I think people who, in terms of their personality, are higher on the empathy spectrum where they feel other people's feelings. So perhaps that may be yourself. And I think people with extreme empathy, who perhaps are the partners of firefighters, do struggle with that vicarious exposure as well. So this is why, as an organisation, we tackle families as well. And there was a big take home from the Global Alliance conference. This is another reason why we need to get around families, because 70% of emergency services personnel and Defence Force personnel will seek help from their primary or intimate relationship first before approaching their primary place of employment or any other agency. So, and then we have a look at the impact of their trauma exposure on that very same primary or intimate partnership. And it's a downward spiral. That's how we end up with this downward spiral, is that these people are being affected immediately in terms of the vicarious exposure, and then they're less able to help because them themselves are struggling. There's some new research going around about the effect on children as well, but I don't think that's been finalised yet. So, but there you have it. Vicarious exposure is real, and there are people who don't watch the news for that reason.
What was the song by Jack Johnson?
I don't recall, actually.
Upside Down?
Is it Upside Down? Perhaps it's a song.
In Between Dreams?
No, I don't recall. I'm sorry. It's a song that.
What was it about?
It's a song about I think it's about some young fella who ends up shooting with a gun or something like that. And it basically says that the desensitisation and the lack of accountability for the traumatic exposure that people experience through media. Basically saying that we've normalised this stuff, and then comes back to the media man, and they talk to the media man in this song, and he says, "Well, mate, I just point the camera where people want me to point it, and if general public stop demanding to see this stuff, I'll stop pointing the camera there."
Yeah, no, so that's very relevant. Yeah.
So it basically ties in, that everybody is responsible for this sort of exposure that we promulgate through the media as just the consumerism of negative images.
It's a good conversation for another time. I think I'd enjoy that. Now, tell me, and perhaps you've explained this, but part of this whole shooting match with what you're putting together, there is a significant online course that you're working on. Can you give us an update on that?
A significant online course?
Yeah, was there a significant online course that we spoke about? Perhaps I misheard you, but I thought there was an online type course that you might have been working on that was going to help fireys. Maybe in our discussions.
Oh yes. No, sorry. Yes. I know what you're referring to. Look, it may end up being online, it may not. That's not the point. The point is about building a matrix of support around firefighters. So whether that's digitally, whether that's an app. So the Metropolitan Fire Service already have something like this on their members only website, and it's a great resource We want to make this as broad a net as possible, and we're obviously working very closely with that team at Wellness and Safety to perhaps do this. But so myself and a couple of the researchers at the Australian Centre of Excellence for Post-Traumatic Stress are working on building whatever this platform or interface ends up looking like.
Yes.
To basically help. I don't know if you ever heard of the ALGE acronym for the mental health first aid. I don't know if you've ever done that or heard of that or anything like that. But when you get to the two E's, encourage support or encourage alternative support. So I guess one's more conventional, I suppose, and the other is less mainstream. But in any case, when you say encourage support, a lot of people don't even know where to start with that. I myself, giving one of my mates a bit of help a few years back, just sort of, go talk to your GP. Health is health, mate. It doesn't matter if it's mental or physical. Go talk to your GP. And that is actually a genuine alternative, a genuine place of help. So, your GP can refer you to other clinical practice and so on fairly easily, or build you a mental health program and those sorts of things. So if all else fails, refer people to a GP, that's great. But we also want to find ways for the partner to seek help, or the closest relationship to seek help. Yeah. On behalf of the emergency services or Defence Force personnel. So
yeah, and that's a good point, and perhaps another discussion at another time, because it's not just the individual; it's the ripple effect. It's the people that live with them, or their brothers, or their sisters, or their mothers or fathers who are affected as well. I mean, it's it has a wide it casts a wide net, doesn't it?
Yes, it certainly does, and even just on shift, I mean, that's one of the things that we're encouraged to look out for is changing in people's behaviour. That's a telltale sign is somebody who's irritable on shift or something like that. And we're encouraged to ask the question.
Yeah, good point. Jono, thank you.
Thank you, and thank you for spreading the word. You do a great job too.
Thanks, Jono.
Are you a podcaster? Maybe you've got that big idea and you're looking for a network to join. The multi-award-winning Ozcast network can get your content to eyes and ears all over the world. Join now for the first month free, and you could be featuring this sound at the beginning of your podcast.
Ozcast.
Simply head to ozcastnetwork.com for details.